of movement is the biggest issue, because you have sustained pressure. And where you have sustained pressure, you have a reduction in blood flow. And this is what results in the destruction of tissues, because when you have full movement capabilities, there are pressures, but they're very intermittent. And so then you're not restricting blood flow within a bone. You're not restricting fluid to be sustained within a structure. You squeeze the water out of a structure, it cannot diffuse nutrition. And therefore, this is where you get a breakdown of spinal discs and things like that. And so again, it's just the sustained pressures that we're trying to avoid and then restore the normal movement capability, so these people have control over when they're applying these pressures.
Welcome to Reconsider. I'm Bill Hartman. This is the podcast to challenge you to ask better questions, to look beyond traditional models of thinking and arrive at better health and fitness solutions.
Breathing.
You want to talk about breathing?
Yeah.
Okay.
I guess we should do that. So highly requested topic, breathing. So what is breathing? What isn't breathing? What makes an effective breath? How should different types of people breathe? We'll talk about nasal breathing. In honor of this episode, I'm wearing my nose strip. That most people don't know that I wear pretty much constantly outside of the podcast. To the point where I don't even know I'm wearing it a lot of times.
Yeah. And
if anyone knows me well, they probably don't even notice it anymore.
No, it's so funny. It's like, I honestly wasn't even thinking about it until
no one even notices it anymore. It's part of my face. I took a headbutt playing ultimate frisbee in 2010. Mm-hmm. And I have a broken nose, so this actually opens my.
I too have suffered I got my face jammed into a basketball court in high school.
Yeah. So my whole septum is like shifted to the left. But this actually helps a lot.
I have even had a septoplasty, but it doesn't appear to have long-term effects.
Yeah, and you're not I don't want to get it too off topic here. Maybe I could just cut this out, but I have a lot of clients that have had septoplasties and turbinate surgeries, and they don't take.
Yeah, well, for a while, I mean, and I'm not passing judgment on anybody's outcome or anything like that. It's like for me, for a while it was good. Like I had a really good 3 to 6 month period in there, and then it just sort of slowly sort of ebbed away. So when I get done with the choppers, I'll probably have to look into it again and see what my other options are. But anyway, so do we want to start with the negative consequences of not being effective?
So the reason why people ask, I want to try to put myself in the minds of the people asking, like, hey, can you talk about breathing? I think what their perspective when it comes from a fitness professional that's asking, or a person who's an exercise enthusiast, they see a video or they hear a trainer or they talk to a physical therapist that says, we need to work on your breathing, and we need to make it like what are the diaphragmatic breathing and belly breathing and all of these sort of buzzworthy things that people hear about breathing. Mm-hmm. I want to try to simplify breathing into what it is, and then what an effective breath is, and what an effective breath is idiosyncratically. So for each individual, how they need to breathe is going to be potentially different than their friend or someone else that they know.
Mm-hmm. Well, structure is going to drive whatever compensatory strategy would be utilized.
And I don't think we've really talked about that specific. We've sort of winked at it, I guess, over the 10 episodes of the podcast. So let's talk about the spectrum of structure and where people can lie on the wide to narrow spectrum of things.
Okay. Well, okay. So we're always going to talk about the extremes just for the differential purposes. So we take, what is it, 7.8 billion people, okay, and we're going to look at them two by two, and we're going to say that there's two kinds of tubes. There's a long, skinny tube, and then there's the short, stocky tube. And we're going to compare people one by one, or two by two, and we're going to say eventually we're going to find the longest, skinniest tube human and the shortest, stockiest tube human. And because their tubular structure is different, their behavior will be different. They will have an extreme bias in regards to how this will influence their ability to expand as they breathe. And so the short, stockier tube person is going to use a much stronger bias towards an exhalation strategy. And this is just by physical structure. So, we could have another hour-long conversation about why this bias exists. But to save time, what we'll say is like the tall, skinny tube is going to be more biased towards an inhalation strategy, although their structure is actually creates a squeeze. This is why they have to have a bias against that, so they can actually breathe in. So they bias themselves a little bit more towards an inhalation strategy. The other strategy is biased towards an inhalation by structure, so they have a bias towards exhalation. That's why we would see the extreme differences. So again, your physical structure is going to determine which way you'll end up going under most circumstances.
Right. So genetics dictates the structure that we kind of take as we develop from an embryo. Yeah.
Mom and dad kind of decided, what your physical structure will be. There's mild influences environmentally and activity wise, but generally speaking, whatever your structure is, that's going to be who you are.
Right.
This is why we see, if you look at performance, like physical performance, this is why you see certain types of structural biases in certain activities. Like if you watch Olympic swimming and as they introduce all the swimmers and they're all standing on the blocks, they all look exactly alike.
Yeah. Well, that's and that's a good example of when specialization comes into play, then you start to see the extremes.
Right. And again, so all of these strategies are favorable influences in regards to certain aspects, but then there's also detrimental effects, right? So if you're skewed in one direction or the other, and because of your bias, then that influences any number of things to the rate at which you breathe, which can have favorable or negative secondary consequences depending on perspective. And so this is one of the reasons why certain people may experience levels of chronicity in regards to aches and pains and movement limitations and things like that because of these structural biases, right? The things that give people superpowers that allow them to do amazing things can also be the reasoning behind why your consequence is that you're dealing with a wonky knee or a painful shoulder or back pain or whatever it might be.
Okay. So keeping it in the context of breathing, and we can talk more about superpowers.
Mm-hmm.
So if we're talking about the extremes here, the narrowest of narrow cylinders and then the widest of wides. And
Mm-hmm.
we're talking about people. So when you think about cylinders, we're talking about think about the cylinder as if I just took the rib cage and the pelvis.
Yeah.
And that would be like where we're talking about the cylindrical aspect of it, and the appendages come off of that, of course, and they're affected by the structural components that we're talking about. But what are narrows in the context of breathing still, even though it is coherent with other types of movement? What are narrows good at versus and bad at versus a wide individual? We'll start with narrows.
In regards to physical activity?
Yeah, movement. When we're talking about movement and breathing specifically, what tends to be, what do each of these tend to be able to do well and not do well?
Your taller, slender, tubular people that we will refer to as narrows, because we talk about structure based on a couple of proxy measures like the angle of the ribs and things like that. They tend to be better at turning. They tend to be better at demonstrating velocity. Internally, their ability to generate pressure, if we're making direct comparisons between the extremes, their ability to generate like high force, high pressure is lesser than the opposing representation. So the shorter, stockier person, because of their exhalation bias, high force producers. So they will tend to be referred to as the stronger people. Not as fast. Doesn't mean that these people can't be fast compared to something else. It's just, again, we're comparing the two extremes as far as where we would see the benefits. Again, like at one end, the taller, slender is velocity. The other end is force, power, over short durations, as it were. So you'll see, like if you look at the difference between an offensive lineman in American football and a wide receiver in American football, that would be a good representation of the two extremes. Both could be considered fast for their structure, but typically you're going to see higher velocities out of the wide receiver. You're going to see higher force production out of the offensive lineman.
Yeah, for our international folks, it would be like a longer distance track athlete and like a rugby player, maybe,
or shot putter.
Yeah, if you want to think about track and field, yeah, that's the best. If it's keeping in the track and field world, you got the wide shot putter, wide throwers, and then you have like your distance runners. You have like pole vaulters and high jumpers. Even there's a little more of your narrower individuals.
They're a little bit more bendy as well.
Yeah, they got to be able to turn. They got to be able to kind of float.
Yeah,
to be able to. Yeah.
Yeah. So again, it just predisposes them towards certain things. It doesn't mean that you can't do certain things at all. It just means that you might be better at something than someone else.
Right. And then it's a really simple way to think about it, because we talk about movement, but we haven't really broken it down to its simplest parts yet. And thinking about it from expansion and compression as we move, the narrows are going to be more on the expansive end of things. So that's going to relate itself to how you're saying it's easier for them to turn and rotate, and it's easier for them to display velocity because its velocity is displayed off of the ground instead of when you're pushing on the ground. So the compression,
they have a smaller window of opportunity to apply force to the ground, and that's just a physical structure thing.
Yeah, when you think of a narrow tube, the space at which the narrow tube can put force down into the ground is going to be smaller. Wide has a larger center or surface area to put into the floor.
Right, and there are numerous examples that people will come up with that are in conflict with that concept, and that's fine. But the understanding that we're talking about structural bias, not impossibilities.
Yeah, we're talking about the bias of structure, why structure changes how we move and our strategies for movement. So I think it's a good opportunity to kind of talk about part of the reason that when you and I started this podcast, we were thinking about like, how do you create a program that helps everyone? Like, the real answer to that is you can't, because a generalized program can't help everybody. So if you take a program that's based more on someone's inherent structure, especially when it comes to the extremes, that's sort of what you and I have been working on. And we wanted to sort of introduce to the people listening to the podcast, anyone that's still listening 5 to 6 minutes into it, it's probably someone who would be interested in this. So what we have going is a program called Recon that we're working on releasing. And that is going to be for people that have run into continued and repeated setbacks with trying to get back into exercise, people that cannot seem to get the changes that they make in their sessions to stick between sessions. And a lot of that just has to do with when people try to move outside of their abilities and what their structure might dictate in terms of what they should be doing for activities, then I think that's where a lot of people end up just sort of banging their head against the wall. And they keep running into continued problems because they're finding programs and they're being told to do certain things based on generalized ideas.
Well, it's like everybody's being compared to an average.
And there's no such thing, really.
Everybody has an idiosyncratic representation that's going to bias you in one direction or the other. And so the people that are closer to the average may see some benefit. And then there's the rest of us that are kind of like, okay, you and I on camera are actually pretty good representation of opposing structures.
Yes.
And so for you to follow the same program as me and expecting the same result, it's kind of unrealistic. And so that's what
Right.
we're doing. It's like we're taking this structural component into consideration to skew things towards where you would be more successful in regards to your exercise selection and execution.
Yeah. So the long story short, we're creating, and we've created a program to help people that have had problems trying to get back into shape. So it's to complete the job of like, what do you do before? What's the program before the training program that you want to do?
Right.
Like, how do you lead back in? How do you change the way that you adapt to stress? How do you change your movement strategy to be something that allows for this continued consistency that's going to lead itself to progress in fitness? So if you have interest in signing up or you want to learn more about this, you can email us at reconyourself@gmail.com, and I'll put a little bit link in the video. But yeah, if you're listening, it's reconyourself@gmail.com, and then in the subject line, just write interested in the program or something along those lines, and then we'll tell you what you can do to get signed up and try it out.
There you go. Excellent.
So we put that out in the universe.
Okay. We should go back to breathing.
Yep. And then so we're talking about the different structures dictating how people can breathe.
Mhm.
And then let's talk about what happens when someone breathes. So like the actual mechanics of breathing, like what is happening that makes that happen? What movements need to occur throughout the body to allow for air to come in and out?
Well, the simplest representation is it's just a change in a pressure gradient. So you have atmospheric pressure, which is what, 750 millimeters of mercury or something like that. And then we need to, I think it's about 750. Don't quote me on that. That for some reason that number pops.
Well, I could totally.
I'm sure you'll look it up for me. But point being is we have to actually create a negative pressure relative to atmospheric pressure, and that's what brings the air in, and then you create a positive pressure, and then that's what pushes the air back out. Thus, the bias that we just expressed in regards to physical structure as to being better at one than the other. And then that, of course, is going to skew muscle activity. So, for instance, what we may see is the influence of the diaphragm. So the muscle that everybody tends to associate with breathing is going to bias itself in a certain direction to allow you to continue to breathe, even though you may have a structural bias that is pushing you in one direction or the other. So this is where the compensations start. And this is where an increase in muscle activity may be associated with a reduction in the ability to move well, because you tend to start to use superficial musculature, the stuff on the outside that we see in the mirror, right? We tend to use those as compensatory breathing muscles to allow us to continue to breathe, which is kind of important because when you stop breathing, bad things tend to happen, right? And so you would rather breathe with an less than efficient mechanism than to not breathe at all. And so again, this is one of those biases of the further you go into a structural difference, the more prominent these compensatory strategies will be. So this is why we're such sticklers about effective breathing, because what we're trying to do is reduce that influence of the superficial musculature that gets in the way of what we would consider normal movement or effective movement.
Right. So certain structural types. So we'll just talk about wides and narrows for the sake of this conversation and further breathing conversations. You're going to have a bias towards either inhalation or exhalation.
Yes.
Based on their inherent structure. So someone who's more compressed is going to need to figure out a way to inhale better because they are more exhaled. Someone who is narrow is going to need to find a way to exhale better because they are more on the inhaled side of things.
Right.
So we see that typically presented, as Bill was saying, the angle of the ribs, the angle especially of the lower rib cage can show you There's a lot of things that are telling. So one thing that people, if anyone's watching this, the things that are telling about like how Bill and I are on the spectrum of, I'm more of a narrow individual, just, better at turning, played throwing sports. And Bill is more along the lines of someone to be good at like weightlifting and football and things like that.
Right.
But what you can see just based on looking at our faces would just be like the angles that are coming like from our nose and our foreheads. You can see it just based on the shadows in our pictures. Bill's going to have a wider representation of this, and mine is going to be on the more narrow end. So if you think about like an hourglass going through someone's face, you'll typically see a wider version of that hourglass in a wider person. Right. And we see these things, and we can see these things sort of reflexively, like we can look at someone and tell the difference, but it's hard to put words to that, I think. So hopefully that's helpful for some people to see the difference between. A lot of people have a hard time seeing the difference between wides and narrows.
Yeah, because again, you think about the broad spectrum of variation. Like I said, we're always talking about the two extremes, so we can create a measure of understanding, and then you're going to have grades of people that will fall everywhere in between. And so some of those are a little bit more difficult to classify, but that's why we will see idiosyncratic movement capabilities associated with your bias, right? So
sure.
The narrow people will tend to be more biased towards external rotation or the ability to turn outward. The wide people will be biased towards their ability to turn inward, which allows them to, again, they're much more forceful. So you have to push into the ground for a longer period of time, and you can push into the ground harder because, again, that would be your bias.
Yeah. So I'm really trying with this episode. I'm really trying to think of the lay people and the layman. So things that I think we're glossing over would probably be what happens mechanically with our skeleton when we breathe. And I think that like what are the things that everyone needs to be able to display to some degree when they breathe that they don't? So I'm thinking of like pump handle, bucket handle, and the way that the pelvis kind of opens and closes, sort of like a flower blooming and closing.
Yeah. So to create the pressure change that we talked about a little bit ago, that's your expansion. So to create the negative pressure, you have to create an increased volume of space. And again, that's what creates this differential between the atmospheric pressure and allows the air to go in. And if I was to squeeze you, all you have to do is like take your significant other, give them a really hard squeeze and just listen. Right?
Yeah.
Yeah, exactly. It's like you're forcing the exhale because you're creating the compressive strategy. And so again, this is how we move air, but this is also how we change shape to move. And so again, if we don't have sufficient excursion between an inhale, the expanded representation of the skeleton, the outwardly turned representation of the skeleton, and the compressed representation of the skeleton, or the inwardly turned, we lose our ability to move in certain ways. That results in the compensatory strategies. That results in aberrant movement behaviors that can result in lowered performance or worse pain.
Yeah. So if you take, I think a good way to conceptualize this for people, if you take your hands and you make like a rib cage with your hands, it's weird how it looks so similar, right? And when you breathe in, you get this sort of opening up. So the two things that I sort of mentioned, that sort of external rotation expansion, and then that compression and internal rotation. But it actually, this sort of movement is actually how the ribs are going to move, as you see my fingers going in and out here. So the wide swinging rib cage is what a lot of people refer to as like a bucket handle action. So the side of a bucket moving up and away and then down and in. And then the thinking about things from a front to back, anterior to posterior perspective, you have a sternum and then a space between your shoulder blades that should expand in opposition as well. Yeah. And a lot of times, a little bit
more front to back in the upper part of the rib cage. It's a little bit more outward and upward, sort of a side to side-ish kind of a representation in the lower rib cage.
Yeah, but together,
it's not that clean. Just for the record, it's not really that clean. It's just the fact that you have a little bit of, you're constrained a little bit more in the upper rib cage because of the sternum. And because of the way
Yeah,
that
'cause
the
you
ribs
have-
attach, so there's a little bit of structural difference that influences why you would see a front to back versus a side to side bias. But
right.
like
But
the whole thing
simply
is doing the same thing, just a different degree.
simply speaking, you want to have some semblance of what we call like circumferential expansion. So if
Yeah.
we want to be able to see air expand in these directions, front to back, side to side, up to down, because the expansion that you're capable of displaying through breathing is going to also sort of indicate where you can and can't move, what spaces you can and can't move into. And then just on top of that, that sort of expansion is happening in a very similar way in the pelvis and the skull and throughout the body. So that influences how you can move, and the interrelatedness between how these pieces can move together.
Right.
As well.
So think about this. If I expand the space in my rib cage, so the lungs, the fluid in the lungs is air. Okay. And then the other compartments, if you will, so from the neck up, from the ribs down into the pelvis, those are primarily water. Okay. So it's just there, it's all fluid based, but in one space you have air. So I increase the space. That means that the water it has to move somewhere else. So as the water gets pushed, so water's incompressible. So this is what causes the expansion from the neck up, and this is what causes the expansion down into the pelvis. Is your guts are water, so they're going to get pushed down the pelvis, and they expand the pelvis at the same time the thorax or your rib cage expands when you breathe in, and the same reason that your cranium would expand under the same circumstance. It's like all you got to do, if you want to feel what it feels like to have your cranium expand based on fluid, just hang upside down, and you'll get a nice little sense of what's happening to a small degree. It's a little bit more comfortable when you're breathing and upright. You don't feel the extreme representation of the expansion, but that's the point. It's like your whole system is expanding as you take a breath in, and therefore that's why it supports the ability to move in certain ways.
Right. So talked about the mechanically what we expect to happen. And that's what, when people talk about breathing exercises and working on their breathing, really what they're trying to do is reclaim these movement strategies, I guess, in terms of like the efficiently breathing and breathing based on your structure. And we want to see that airflow happening in these spaces in all these different directions.
Right.
What typically happens to people, anyone experiencing any type of issue that might require them to pay more attention to their breathing? Mm-hmm. What are the typical presentations of that? And what are the things that those people seem to lose the ability to do?
Okay. So when you think about the inhale, and then you think about separate bones, each bone has its own way to move relative to another bone. So we have things that move in opposition, and that would be represented in an effective breath in. So if you think about, the pelvis is a really easy one to see, where your sacrum or your tailbone will move differently than the hip bone, than the innominate. So they move in opposition to one another. I have a pelvis right here. You want me to grab it?
Yeah, I was going to grab mine. I have one too.
So
should we both have our
pelvises
pelvises on the screen? Should we get our pelvises? We get our pelvises to talk to each other.
This is the lamest thing I've ever seen. This
will be the thumbnail of us just holding pelvises.
So I'm just going to show this, Chris, because it'll make sense. So when you take a breath in, your sacrum, this is where I got my index finger there. That's going to move backwards relative to this is the innominate bone there. So they move relative to one another versus moving together.
Right.
Okay? So when I take an effective breath in, I have this relative movement. And then we think about like all the other bones in the body will move relative to whatever they're attached to. Right. So
can you grab the pelvis? I think, is that pelvis wide enough for you to put your hands up into?
Yeah.
The representation of inhale where your hands kind of open and then exhale being this is helpful for people to see. So we're talking about that.
It opens like that. Don't break the pelvis in the front like mine.
Yeah.
but it would open like that, basically.
Right.
So it's got to
And then-
accept. So the guts are coming down as you take a breath in. So there's got to be more space. So it opens up, and the representation of a flower opening is usually a good understanding of that happening. Yeah. So the whole thing, the whole thing sort of expands so it can accept the volume of the internal organs as they're getting pushed down as you take the breath in.
Okay. And then,
But the point of this is the effective breath in produces a relative movement, right? So again, things are moving relative to something else. When you have a compensatory breath, all of that moves as a single unit in a specific direction. So instead of having this nice relative motion between segments, everything moves together and can be very useful in sports performance or some effective high force activity associated with your work or whatever. But it also results in pressures and tensions in very specific areas that can result in pain experiences.
yeah, when you're talking about, when you're thinking about aggressive forces and gyroscopic forces, and I want something to happen abruptly and sharply and into like a high magnitude, so like a jump or a very high velocity throw. I need so this pressure and volume gets kind of thrown around through your body, and I need it to hit a wall sometimes, a very abrupt stop and turn around. And that's going to create, and that helps kind of create this sort of slingshot action that's needed in other places in the body, because you need a really hard fixed point to work off of.
There are definitely certain times where things should not move relative to one another. High force situations would be that situation, but you don't want to walk around using a high force strategy in low force conditions. So I should be able to move between the two strategies. And that's one of those things that we work on a great deal with people, but it's also that, again, that's why we emphasize the breath during certain types of exercise, because the goal is to restore these relative movement capabilities. They tend to improve comfort. They tend to allow you to dampen forces versus putting them specifically on certain structures. So, again, people come in with like a knee pain or an elbow pain or a shoulder pain. It's because the forces are not moving, they're not dampening through those structures, they're becoming focal. And then that's why we start to recognize that in certain instances as, again, a reduction in movement or pain.
So here's this one's going to resonate with a lot of people, because a very high percentage of people have had back pain in their lives. And a lot of people are going to talk about L5-S1 as being that sort of focal spot. So why would it be that so many people have issues at, let's take a couple examples. Let's talk about the transitional segments in the vertebrae. So in your neck to thorax, in your thorax, in the middle of your thorax, like the TL junction, and then the L5-S1 area. Why would those areas be particularly hot or prone to painful feelings and injury?
Well, when you're transitioning between the thoracic spine, which is where the rib cage is, and then the lumbar spine, it's like there's a rotation that needs to occur in those segments, and if you take that away, so if you compensate, and instead of having, again, the relative motion where they can turn in opposition, when they're compressed together and then they move as a single segment, then again, there's just a greater load. There's a lack of distribution of the load, and it becomes a focal load. Same kind of thing in the transition between the sacrum and the lumbar vertebra. So the L5-S1, okay, that's the transition between the solid looking bone of the sacrum and then the first lumbar vertebra. And that's going to be the transition where if I lock the pelvis together as a single bone, so instead of having the relative motion that we demonstrated before, I'm going to have the entire pelvis orienting relative to that next spinal segment. And so that's going to create a lot of compressive strategy literally right at that segment. And so it's a real common area, which is why, most of the spinal disc injuries that you're going to see are going to be in the lower part of the lumbar spine for that reason, because that's that transition point where the pelvis will start to move as a single unit.
Right.
And then the spine will actually start to do that as well. And then there's just the greatest amount of pressure right at that segment.
So there's this, we need this ability. So trying to come back to what we've been talking about so far, we need this ability to expand and compress effectively. And let's keep talking about the pelvis and the lumbar and the low back here as this example. So if I lose the ability to display this expansion and compression, and these relative motions become lost in the pelvis, I become very stiff in that area, and the pelvis starts to orient in one piece in all of these directions to move. But more importantly, since that area is locked up, I have to start looking above that area and below sometimes to the bones that have a larger degree of freedom. So the lumbar spine has pretty large degree of freedom in different directions. So that becomes an area where there's a lot of undue bending that has to happen, and rounding through the spine and bending as I try to change and orient myself through space. So that can lead to overuse and having to try to use those segments of my spine, or even like my lower or my upper legs and hip sockets, to try to bend and twist their way through space when the pelvis won't allow me to do so.
Yeah, the lack of movement is the biggest issue, because you have sustained pressure. And where you have sustained pressure, you have a reduction in blood flow. And this is what results in the destruction of tissues, because when you have full movement capabilities, there are pressures, but they're very intermittent. And so then you're not restricting blood flow within a bone. You're not restricting fluid to be sustained within a structure. You squeeze the water out of a structure, it cannot diffuse nutrition. And therefore, this is where you get a breakdown of spinal discs and things like that. And so again, it's just the sustained pressures that we're trying to avoid, and then restore the normal movement capability, so these people have control over when they're applying these pressures.
Right. Okay. What I want to do is let's wrap up talking about the mechanical aspects of it, just as that was our general introduction to it. And then we're going to get into like what we can do about it, what breathing should look like. We'll relate it to some activities. And then we'll talk about what we see as people's understanding that they gather from Google and therapists who might not be as well informed or misinformed even, and then what we can do about those ideas that need to sort of be killed as well. But we'll break this episode up into two, because we're already at like 30 minutes. So I don't want to have an hour-long episode. So we'll have a part 1 and a part 2.
Okay.
So if you're still watching, we will see you shortly as you go to the next episode. Or if you're one of those people that watches right away, then you're going to have to wait a couple weeks. Sorry. And what can we talk to the folks that are actually watching toward the end of this? What should we ask them to talk about in the comments?
Oh, like you mean like the superhero thing like we did before, or
yeah.
Oh man,
there's definitely people that do watch it to the end of it.
There's been a few people that have actually made the comments on the superhero thing.
Yeah.
Oh man.
Okay, so what's your favorite? So we'll keep in the vein of superheroes. What's your favorite superhero vehicle?
Oh,
that's a good one.
Interesting.
Yeah, I have a couple. So you can categorize it if you want. Like I have like what's the most ridiculous?
Oh, I have the most ridiculous.
I mean, okay, well, we'll start with that, because so we're not talking about ridiculous. We're talking about like, what do you think is like the coolest one? And you can make categories if you want. What's your most ridiculous?
Oh
no, so you and I are going to talk about ridiculous.
Oh, ridiculous.
Yeah, what's the most ridiculous one?
The Spider-Man Doom buggy. Do you remember that?
Yeah, I do. That's so funny. Mine is always going to be Wonder Woman's invisible jet.
Oh,
it's just so silly. It's just like it's at a certain point, someone was I don't remember which author was just like, let's just make her fly.
Reconsider is sponsored by Substance Nutrition. Go to substancenutrition.com. Get your Neuro Coffee, better brain, and Synthesis, better protein, better body. Enter the coupon code RECON, RECON, and get free shipping on all of your orders.